Brilliance Audio presents The Cure Within, A History of Mind-Body Medicine by Harrington, performed by Christina Traister. Introduction: Stories, Science, and Culture Under the Skin. Why do we fall ill? Most of the time, most of us believe we know the answer. Some illnesses are due to infection from a virus or bacterium, some to the breakdown of proper functioning of some organ in our body, some to a deficiency or excess of some crucial hormone, enzyme, or other chemical we need to be healthy. We believe, too, more and more, that genes often play a role in illness, that certain diseases run in families. At the same time, we willingly accept that some diseases are triggered or exacerbated by a toxic environment, living by a chemical factory, a bad diet, too much saturated fat, or unwise habits, cigarette smoking. All these understandings have in common one thing: a belief that physical symptoms of illness have physical causes. If the physical causes of our illness are not immediately obvious to the unaided senses, then people expect their doctors to use X-rays, ultrasound, CT scans, laboratory analysis of blood or tissue, or surgery to look more deeply for the cause of what ails. Once the doctor can see what is wrong, the hope is that he or she will be able to tell the patient how to fix him or herself, what drug to take, what kind of surgery to have, what change in diet or lifestyle to make. For many these days, this way of thinking about illness includes even the class of disorders we still call mental illness. Quite often, this physicalist way of thinking about illness works. Patients take the antibiotic and recover from their infection, learn to inject themselves with insulin and normalize their blood sugar levels, have surgery and learn that their cancer has gone into remission, or take the antidepressant and find they can get out of bed again in the morning. What happens, though, when one or another of our standard physicalist approaches to illness does not work, fails to satisfy either doctors or patients? For example, what happens when someone develops all sorts of somatic symptoms and is clearly suffering, but medical tests fail?
Sample complete. Ready to continue?